United States Agency for International Development's withdrawal of funding for HIV and AIDS interventions in Bauchi is starting to show its impact, and it's not looking good at all. The loss of support has left treatment centers facing shortages, clinical care taking a hit, and essential services being scaled back. Abdullah Ibrahim, who leads the Bauchi chapter of the network of people living with HIV and AIDS in Nigeria, raised the alarm about the situation. He is particularly concerned about treatment interruptions, warning that these breaks could lead to drug resistance and complications for patients. To make matters worse, more than 22,000 volunteers in the state are now jobless and unable to help with caregiving. Calls are now being made on the state government to step in by integrating these volunteers into the healthcare system and including HIV/AIDS patients in the state's health contributory scheme. Well, to further analyze the impact of Usaid's withdrawal of funding for HIV and AIDS interventions, let's hear from Dr. Adeze Ore, the Commissioner for Health, Rivers State.
If we think about PEPFAR, which is President's Emergency Fund for AIDS Relief, it's tantamount to their principles and why the program was set up in the first place, realizing that there was increasing prevalence and new cases of HIV and increasing numbers of patients who were going on from HIV into full-blown AIDS. And so to curtail the blowout of the infections and limit complications and deaths from HIV, PEPFAR was a significant contributor to Nigeria's HIV and AIDS response. And so when we think about what that implies, we think about treatment and services, we think about testing, we think about even mothers who are receiving antenatal care, who are being tested and prevented from transmitting HIV and AIDS to their newborn. And then even for the complications that could arise from HIV and AIDS, the management of such complications is also inbuilt into the whole PEPFAR program. So you have armies, just like what you reported in Bauchi, across states in Nigeria, armies of staff, volunteers who are part of that HIV and AIDS response in the country.
Okay. So with the recent freeze on AIDS funding, we're already witnessing, like you've just said, we're already witnessing its impact on Nigeria, for example, what we've heard about in Bauchi. So from your purview as a healthcare professional, as a Commissioner for Health, what other immediate impacts are we seeing on healthcare programs? Can you tell us anything that this withdrawal of funding has, any impact it has made on Rivers State or any other states in the country that you're aware of?
I would say for us in Rivers State, we are quite fortunate, but because you're asking about the impact, so the impact on test kits, so the PEPFAR program has been critical to the supplies of HIV testing kits across states in Nigeria. So if we think about the milestones that we want to achieve in terms of HIV and AIDS, first of all, how much of the general population are aware of their HIV status? Mm-hmm. It relies on testing kits so that people can find out their status. And then not just finding out their status, they need to then go on treatment if they're found to be HIV reactive or HIV positive. And then from the treatment, they should be viral load suppressed. So if the test kits aren't there, you have millions of Nigerians who would not know their status and would not then have the opportunity of getting on treatment. Then coming to the treatment in itself, the treatment commodities, the antiretroviral medicines, none are produced in Nigeria. They're mostly imported and supplied through these PEPFAR programs to the country and nationally distributed to states across the country. So then again, in the second indicator that we'll be assessing, which is how many people who know their status are HIV positive on treatment, you now have another line of impact, which is the medicines not being available for people who would need the treatment. And if they don't go on treatment, then they can't be virally suppressed and they go on to transmit the infection, thereby increasing the prevalence. Several years ago, there was a national survey, household survey on HIV and AIDS, which showed that Nigeria's prevalence had reduced from upwards of 3% to about 1.4% nationally. Now that prevalence is in jeopardy, because if individuals are not able to know their status, go on treatment, become virally suppressed, you have an explosion of new infections that will raise the national incidence rates, new cases, and of course the prevalence rate for HIV. So we stand to lose a lot of the substantial gains that have been recorded over the past 20 years of PEPFAR being in the country.
Absolutely. And then you mentioned something which came to mind when this whole withdrawal thing was announced to me in the first place. So you said none of these drugs are manufactured locally. To me, that highlights the necessity for self-sufficiency. So I don't know, do you agree that there's a necessity for us to be self-sufficient, especially when it comes to providing health solutions for our own particular health problems in Nigeria and Africa in general?
I 100% agree with that. First of all, aid is supposed to be complementary. Aid is supposed to be supportive or nurturing to help a system to take ownership and take over responsibility for the distribution and the provision of services for health. Now, what we have seen is that without having indigenous manufacturing of these commodities, we are on the receiving line and therefore vulnerable to decisions, executive decisions such as Trump's executive orders that have put us where we are now. There are also regulatory inequities that favor the West. And so many African countries have fallen short of the ability or the capability of surmounting those regulatory requirements and being able to be self-sufficient. So some of the priorities that we need to take stock of now as a matter of urgency is domestic manufacturing of these commodities. And nationally, we're seeing an increasing attention on unlocking the value chain of the health system and encouraging states to create environments that attract investment into pharmaceutical manufacturing. This calls for both public and private collaboration so that where those regulatory requirements government can support and indigenous pharmaceutical manufacturers can then, with that government support, surmount some of those inequities that have faced the private sector for the longest time. Health is not something that brings about immediate returns, and so it's often difficult for health-focused businesses and enterprises to get the financing that they need. And this is where government can come in and support and create that enabling environment that would attract health sector investments because they realize that that enabling environment is there, that supportive environment that can enable them grow and scale and provide the medicines that we need locally. See, COVID-19, we were at the back of the queue, dependent on what could be sent to Nigeria because most of those commodities that were needed at that critical time were not manufactured within the country. And so I would say domestic manufacturing of pharmaceuticals and commodities is critical. And this is one of the decisions we have to take as a nation to prioritizing.
Okay. So let's move on now, again, putting the focus on Rivers State. As Commissioner of Health, how is your state preparing, seeing as we're being proactive, as the lessons from COVID-19 have shown us that we need to be? How are you preparing in your state to navigate these funding challenges and ensure uninterrupted access to critical healthcare services, particularly with HIV and AIDS?
So one of the things I said when you asked your last question was that we are quite fortunate in Rivers State. And the reason I said that was because we do have some of those medicines and commodities for several months that are available. So even beyond that 90 days pause period as stipulated by the US government, we still have commodities in place and test kits in place to test our populations to ensure that people get on treatment. And we're using this time now to take sustainable and more intentional decisions. Unfortunately, for states like Bauchi, the workforce, the volunteer workforce that is affiliated with PEPFAR is in the doubles of the tens of thousands, 22,000. For us in Rivers State, it's much less because we early on started integrating those program officers within the state health system.
Right.
So our volunteer and ad hoc staff base is not more than 1,000. And beyond that, last year, the governor of River State, Governor Siminalayi Fubara, announced the employment of 2,000 health workers across the state. And so those health workers would also be benefiting from some of the training and some of the capacity building that ad hoc staff under the PEPFAR program have benefited over the years. There has been a very strong message from PEPFAR and Usaid over the years about the need to go into sustainability, for states to be thinking more sustainably and integrating services. And I believe that this sudden decision brings us to the point where we now have to act very intentionally, building with the mindset of sustainability and strengthening our existing health systems. And so for us, we also have that investment focus on attracting local manufacturing into the state. Towards the end of 2023, His Excellency made a more concerted effort about engaging with pharmaceutical manufacturers and seeing what can be done about reviving medical industries in the state. Okay. And hopefully in the next few weeks to months, we should be flagging off systems that drive medical, pharmaceutical, and commodity production within the state. That also has implications for job creation, employment, creating a steady pipeline, unlocking the value chain of medical, pharmaceuticals, and commodities, not just for River State, but for neighboring states, and serving as an example that other states can take up, seeing that it's workable within the country.
That's impressive, and I'm looking forward to that. I'll be watching. So now that this halt on funding has happened, and like I said, we are taking charge and being proactive, what role can community advocacy and private sector partnerships play in bridging the gaps until this funding disruption is called off, or even if it isn't called off?
So one of the things that these announcements about the funding pauses have generated is fear and anxiety.
Absolutely.
And I was just having a word with our state program manager for HIV and AIDS in River State, and we felt the need to also express to the public that those HIV AIDS services, the testing, the treatment, the care, the counseling, the antenatal support that have been existing are still available and free to the public. Because, of course, with any uncertainty, there will be people who try to take advantage. And we're seeing that in certain facilities, some public, some private, there are people who are trying to sell some of those available commodities to an unsuspecting public. And so with your question on community advocacy, we have a lot more to do now with engaging our communities and getting the message out there that we're not at a halt period where nothing is available and it's now survival of the fittest. The test kits, the medicines are available, and the state is taking concerted efforts to make sure that even beyond the availability of the current stock that we have, there will be available stocks. And as at now, they are free and they are available. So we have to really engage with our communities across board, the stakeholders, traditional and community leaders, using existing media platforms such as Arise TV and beyond to get the message out there. And then for public-private collaborations, like I said, there are private pharmaceutical manufacturers, but they require the support of government to thrive. And this is where we should look at the ease of doing business within the states. What are those barriers and roadblocks that businesses, especially in the pharmaceutical sector, would encounter, and how can we help ease those challenges for them so that it becomes an attractive space? Because if we're talking about Governor Fubara's Health for All River strategy, it is about part of that. One of the pillars is about accessibility of essential medicines and commodities. So as a state, what can we do by opening the doors to pharmaceutical manufacturers, speaking with them, finding out what the challenges are? Of course, with the mindset of ensuring that quality and standards is always upheld so that the people and the lives of the people is protected at all times.
Absolutely. So let's wrap up the conversation now with one final question. So Dr. Ore, you've been a strong advocate for undeserved communities. What is your vision? I mean, we've already highlighted one of them, which is moving from over-reliance to support. What is your vision for a resilient Nigerian healthcare system, one that can thrive amid any global funding pauses, any uncertain viruses like COVID-19?
For my vision for that health system,
A resilient healthcare
that
system.
resilient and robust health system,
Absolutely.
is one where, first of all, we know that majority of our population in the country reside in rural areas. How do they get access? So for me, that resilient and robust system means that for everyone within the country, there's access, geographical and financial access to quality healthcare, meaning that majority of the population is enrolled in health protection schemes, health insurance schemes that protect the most vulnerable. And so regardless of earning power, regardless of ethnicity, everyone in Nigeria can get access to quality healthcare. Beyond that, when they have access to that quality healthcare, are there health workers there? We know about the brain drain, the Japa syndrome. How encouraging is our health system to keep people within? And even encouraging to those who may be in the diaspora, who feel that they have services, they have skills, they have knowledge that they can also bring to bear to the health system. Because it is what they see within the health system that attracts them to come in and support. So that we limit the exit. Because for a lot of professionals who leave the country, it is because there's a sense of nothing seems to be progressing, either personally and professionally, or within the system. And so they go to already established systems. So how can we make our own system attractive enough to retain people and even attract people to return temporarily or permanently to contribute to the system? Now, leadership and governance. How do we ensure that as we're increasing domestic financing, because that's another thing we need to do in this era of funding pauses from international aid, as we're increasing domestic financing, are we putting in place rigorous mechanisms for accountability, for transparency, for judicious use of those funds, so that for every kobo we're spending, it translates to another life that is saved, another person's well-being that is enhanced? Beyond that, we're now in a technological age. How much of digitization are we incorporating into our systems? We should be stepping beyond those shelves and cupboards and stacks of manual patient records, so that when you decide that you're leaving the FCT and you're moving to another state, your data goes along with you and you can easily access it. We are now in a very mobile and globally oriented state within the world, and so it should be reflected within our health system. So when I think of a resilient health system like this, it is one that is community-centered, it is people-oriented, and it is able to absorb shocks. So if we have this kind of system that is focused not just on treating illness, but on preventing ill health, then we can be talking about health security. And so when there are shocks like COVID-19, as you mentioned, there are existing systems that are not wholly reliant on external financing, but are built on existing systems that can withstand those shocks, learn lessons, and immediately iterate and take on whatever challenges that we face. But it's a whole of society approach. We also need to be engaging with our communities and getting feedback on the responses from our systems. We think we're improving systems, but one person's experience may not reflect that improvement. And so also having that listening towards our patients and our clients to find out where there are areas that require improvement.